Dear speakers, guests, participants, good day, good afternoon, and welcome to virtual meeting COVID-19 opening up data to meet the needs of Slovenia. With this meetup, Slovenia is joining the effort launched by the Open Data Charter and the OECD Digital Government and Data Unit, who have started international collaboration to identify the specific data types relevant to their COVID-19 needs. With these virtual meetups, we are opening discussions about specific data sets that are needed for an efficient and effective response and recovery from COVID-19. The focus is also on the biggest gaps and a more consistent approach to publishing quality, comparable, and trustworthy data. And of course, the question for future is also on agenda: how to be more data ready next time. So far, data meetups have been held in Canada, New Zealand, Catalonia, and Mexico. Welcome once again to all of you. We will be together for about an hour and a half. Just a minute for short instructions. Please turn off your microphones, so use the mute mode. Speakers are kindly asked to limit their presentations to maximum 5 minutes. If you exceed your time, I will try to give you a somehow secret sign. Later, the participants will be divided into 2 groups, so 2 breakout rooms. In case you didn't register yourself for one of these groups and you would like to participate in one of them, please write your name, surname, and the name of the group to the chat. So now let's start. For first welcome speech, I'm inviting Mrs. Natalia Karfi, Deputy Director of Open Data Charter. Please, Mrs. Karfi, the floor is yours.
Hello, everybody. Thank you very much. Thanks very much for organizing this. And we are very happy from the Open Data Charter to be co-hosting and helping organize this meetup. As Katja very well said, we've been collaborated with OECD in trying to understand from the data perspective how this pandemic has been evolving, how governments are actually responding to it, and trying to think how we can better prevent for the future in possible future pandemics, to understand which data is needed. So thank you very much for joining this event, and I'll be glad to see what the discussion goes about. It's really important to understand the local data needs in order to give a better response to citizens about what governments are doing on like dealing with the pandemic. So thank you very much for the invite, and looking forward to hearing the discussion.
Thank you very much, Mrs. Karfi. Now, Mrs. Barbara Ubaldi from OECD, Deputy Head of Division and Head of Digital Government and Open Data Team. The floor is yours for your welcome words, please.
Thank you. Thank you very much. It's a pleasure to be part of this exercise, which is one of the activities we have undertaken at the beginning of the pandemic with the International Open Data Charter. And I thank my team for having been so active and focused in trying to increase the number of these activities. And I'm going to explain to you now in a few words why. Because I think that the pandemic demonstrated very clearly the urgent need for having data, that are accessible, timely, accurate, and relevant. We've been asking in the past 12 months governments to tell us to what extent they had been using open data initiatives to support better results in terms of the design of policies, the identification of concrete services and solutions, and keeping the public informed. And what we've seen after having analyzed a number of evidence and cases from around the world is that governments have concentrated their efforts in using open data to strengthen public communication, meaning to keep people abreast and up to date on the evolution of the virus, on the availability of masks or other equipment that was relevant for the people to manage the crisis. But we know that the crisis is a multifaceted crisis that requires actions that go well beyond public comm. And in a way, these results that we've seen demonstrate to what extent governments still need to reinforce their focus on working with the ecosystem, meaning working with the stakeholders, working with the private sector, working with the academia, the civil society organizations. Why? Because the reuse of the data also to address policy issues and to come up with concrete innovative solutions is essential to make sure that beyond communication, we can actually create some value that is a concrete value for the people in a specific country. That's why, like Natalia said, knowing the demand and providing data that can help responding to specific challenges in a specific country is essential. Slovenia has been focusing a lot in making sure that open data policies and initiatives get to concrete results. We've been working with Slovenia, which is an OECD member country, on digital government data and open data for now in detail almost 2 years. So we have been witnessing also the important evolutions that Slovenia has been doing, because you always had a key strategic approach towards open data, moving beyond the statement and being concretely linked to the value you wanted to create. I think many interesting examples of how you used open data also to identify opportunities, for instance, for people to go on holidays when we thought we could breathe a little bit more in the summer was very interesting. So how you were trying to link necessities with opportunities, broader policies on open data, but not only, also on COVID-19. So I welcome very much the fact that Slovenia accepted to host this meetup, because it's very important for the global open data community, but it's also very important for the OECD community, because this is a concrete example on how you got the point that if we don't connect better with the ecosystem, then the reuse is not necessarily there, or efforts to open up data don't necessarily bring the results because they don't necessarily respond to a specific demand. So I stop here because I really want to just give more space to the rest of the interactions, but very nice to be here and to be part of this exercise. Thank you.
Thank you, Mrs. Ubaldi. And now Minister of Public Administration, Mr. Boštjan Koritnik, kindly invited to your welcome speech. The floor is yours.
Thank you. Ladies and gentlemen, dear participants, it is a pleasure to be here today and to be able to welcome you at the COVID-19 Open Data Meetup. I would particularly like to welcome the representatives of the OECD and the Open Data Charter and the participants from abroad. Well, COVID-19 circumstances have forced us into unprecedented situation where, especially at the beginning, it was extremely difficult for governments, health institutions, other public institutions to decide on what decisions to take in order to secure public health and safety. In such situations, more than ever, efficient provision and access to right data is needed. Our intention today is to discuss data and identify data sets that are of high value in relation to the pandemic. When the pandemic hit last year, we may have been unprepared. Now, a year later, we agree that it is appropriate time to try to think over the state of the affairs so that we could be better prepared in the future, to be able to take appropriate and effective decisions in this and in the future, I hope they won't come, crisis. The Ministry of Public Administration has traditionally been active in the field of transparency of the public sector, with a special emphasis on open data. We see the National Open Data Portal and the network of public servants and practitioners built around that is as the crucial accelerator in the field. The framework of open data experts therefore seems as the most appropriate also for today's debate. In Slovenia, many excellent examples of applications emerged that help the general public and institutions to understand the pandemic. Coronavirus Media Watch, to mention one, that was launched by the UNESCO's International Research Center on Artificial Intelligence, which is based here in Ljubljana. Another good example is a crowdsourced app, COVID-19 Sledilnik, which serves as a source of data for other apps and has received a special reward from the President of Slovenia, acknowledging that provision of quality data is crucial in building trust among the citizens. I have been personally especially proud of the COVID-19 application that the ministry has developed in just a few weeks' time on the basis of the German Open Code. And the project provided a very valuable experience of how to provide the public with the health data while guaranteeing the respect for the privacy of the individual. We are excited to be able to provide an insight from Slovenia to the final common document on open COVID-19 data, a document which will serve as a guidance for responsible release and consistency of data, both for recovery from COVID-19 and better preparedness of public and private sector actors in the future crisis. I wish you all fruitful discussions, and I'm looking forward to the final report. Thank you.
Thank you, Minister Koritnik. And according to agenda of today's event, we are moving to second part of the event. So these are peer exchanges. We will be briefed about different countries' experiences and their praxis. So first, let us hear about New Zealand solutions. Can we maybe start a video, because in New Zealand, I know it's very early in the morning, so I think we will be able to watch the video. Thank you.
You all from New Zealand.
Can you hear the sound?
Greetings to you all from New Zealand. It's fantastic that you have gathered together to talk, listen, and generate ideas about how to support each other in your communities through open data. It's common for governments everywhere to feel they must provide for everyone fairly. And on the other hand, it's common for citizens to feel the government should provide for them and all their needs. This is only natural, but it's also unrealistic to know about all the needs of everyone and to cater for them all without working together. By gathering as people who live in communities of all kinds, and that includes those of you who work in government, as we all live in amongst families, friends and neighbours living through many different situations. By gathering together now, you have a chance to share the stories about what you or the people you care about are going through. And together, think about what data could help you with better understanding who else might be in a similar situation and to think about solutions. Together and with the help of open data, I believe we can all be more resilient. As an example, at our meetup in New Zealand, one participant worked in the youth hostel and became aware of people trapped when flights began to be cancelled and borders were closing. These people had visitor visas or short-term work visas that were going to expire, but they could not leave. Some knew very little English. They could not afford to keep paying for accommodation, yet because of their visa status, they could not get work to pay for their living expenses. The meetup helped raise awareness of the demand for data about numbers of people in the country on limited or expired visas and where they were from, so that resources with appropriate language skills could be mustered to help them. Another example on a transparency front is that as the pandemic situation evolved, data about the capacity of our border controls became more important to people than the actual COVID case numbers. And as we are all too aware, unfortunately, this pandemic is not over and the needs will continue to change. So the conversation you're about to have is hugely important and has the potential to make a real impact going forward. I encourage you not to waste this opportunity complaining about what has not been done, but to focus on caring for people around you, articulating their plight, and to put your energy into creative thinking about what we need to know to better understand the challenges and address them. My best wishes to you all, and as we say in New Zealand, kia kaha, stay strong.
Thank you very much to Mr. Paul Stone. As I said, it's very early in the morning in New Zealand, so we were able to watch the video presentation of Mr. Paul Stone, Principal Advisor, Sector Information at Ministry of Justice and Chair of the Open Data Charter's Implementation Working Group. So let's continue with the second presentation. Mr. Pablo Villarreal, head of the Technological Services Unit and National Digital Platform, is with us and will share experiences of Mexico. Welcome, and the floor is yours.
Thank you very much, and thank you everyone for the invitation. I think these kinds of exercises are very fruitful for all of us. These kind of peer exchanges are the ones that help us to thread the needle the best way possible. So this pandemic, this long pandemic, has turned from a health issue into an economic and social issue, and that will carry on for the next couple of years. So this is a fact, and this is something we all know that's going on. And us in Mexico, understanding this, we try to work to identify how with data are we going to help people, average citizens, to make better decisions. And not only average citizens, but also public officials. To make better decisions, not only in terms of health, which is crucial right now, which is the main concern we all have, to be healthy, but also in terms of economic, social, psychological, many other decisions that are impacting our current and our daily lives today. So the effort that we're trying to do, or that we are doing currently in Mexico, is understand the links between certain kinds of data sets, the links that one data set has with each other, in terms of how having data on a specific thing can impact the decision making that will impact another data set, and how information is all linked, and how having the appropriate, open and updated data on something very specific will have an impact for everyone in the lives of people in the current situation right now. So aware of this, we're developing an open data guide on specific data sets that we've identified as crucial in terms of health, in terms of social data, and in terms of economic data. It's been very interesting to understand and to identify where the data is and the lack of quality data. And this is something that I think is very important for all of us, and that I will put forward on the table, which is a challenge that I think all of us are facing. There is a lack of quality data for appropriate decision making. So this is the step we're stuck in right now. We have to make sure that the data that we publish and that we recommend should be published in terms of these three sectors that we've identified is quality data, because this is the first thing we need in order to make decisions based on evidence. So quality data has been, we started this project as a very holistic and general project. But what we've identified now, and where we are trying to focus, is to recommend authorities to publish specific data sets of quality data for a good decision-making process. We've been working with the International Open Data Charter on this, and we've been working with a bunch of stakeholders from different sectors that range from civil society organizations that are tracking data on health issues, on social issues, on economic issues. We've been working with public officials also in charge of data on these three sectors. And the thing we want to do is to recommend what and how to publish the data to public officials, so that we as citizens and citizens of Mexico can make better decisions that not only impact their lives, but also impact the way in which public officials are making decisions, considering other data that is not being considered, and that is part of a chain of information that impacts the decision-making process. So this is what we've been working on in Mexico. It's been challenging because the lack of quality data, and we do expect this project to come out as a guide that really works and that can be implemented at the national level, eventually at the local level, because something else that we face right now is that we need data not only at the federal level, but at the local level where people live. People live in municipalities, people live in communities. So there is a lack of understanding of the value of open data that has to be published there. So this is another big challenge we faced. We have data at the federal level, but if we don't have data from the communities that make up the country, we're not working and we're not doing the work that has to be done because people live in this community. So at the end, this guide aims to bring awareness to public, to decision makers and to the public in general of the importance of open and quality data in specific things and the impact that publishing certain data has in a chain of other data sets. So this is Mexico's experience. This is what we've been working on. And we're more than open to share what we've accomplished so far, what we've seen, the challenges we're facing, and the importance of having open and timely data on specific things right now where we're living in an economic, health, and social crisis worldwide. We're all living the same thing, which seems a bit surreal, but that's the fact. So we all need quality and open data in this sense. Thank you very much.
Thank you very much, Mr. Pablo Villarreal. The discussion will continue in breakout rooms later. So thank you for now. And the Praxis of Canada will be introduced by Mrs. Megan Wiley, research analyst at Open North. The floor is yours, please.
Thank you so much. And thank you, everyone. You can hear me okay? All good?
Yes.
Okay, perfect. So my name is Megan Wiley, and I'm a research analyst at a nonprofit based out of Canada called Open North. And so maybe a little bit different than our previous presentations, we're a civil society organization. We work a lot on data and technology, trying to make it work for communities, thinking about responsible and effective use of data and technology. And we got involved in this initiative because we are also on the ODC's implementation working group. So we're eager to bring government, civil society, academics, a bunch of people together under these meetups. So our role was really convening and documenting. So I'll share a little bit more about our meetup. We had, similar to this, 5 speakers, but they were all from Canada and represented different viewpoints on open data throughout the country. Most notably, our keynote speech was by Mr. Anil Arora, who is Canada's chief statistician. He's involved, he is in charge of Statistics Canada and publishes a lot of our national data sets. So he came in and gave a keynote speech to really set the stage and bring in some of the viewpoints, some of the things that they had been working on. And we were joined by over 100 participants who contributed about 44 unique data set requests. And it was over 200 contributions overall. We just kind of grouped them by themes afterwards. So a lot of active people and a lot of great speakers that opened up our stage, very similar to you guys today. In those 44 data sets, I think there was a few that were notable to us within the Canadian context, and I think this has been a conversation globally as well. There's a real need to understand the impact of COVID-19 on different groups of people, specifically on different racial groups. So in Canada, we actually didn't collect that data and still are struggling to collect that data at all levels of government. So both our national government, our provincial and territorial governments, etc. So this has been a high demand from Canadians. It was expressed a lot in our meetup, as well as by journalists in the media, and this is still an ongoing issue. So we hosted our meetup in July, on July 2nd, 2020. And I was just looking into it last night. The province of Ontario, which is one of our largest provinces, is starting to collect this data, but not report it openly. The Canadian Institute for Health Information has started to post standards on it. So we've seen this pandemic really accelerate the generation of data on race, which is a good move for Canada, but still needs a lot of development there. Another data set that we really heard that was desired was to understand where the government programs were going, to who was receiving them, how much, and what the impact was. So in Canada, we had a lot of government programs roll out in April 2020, and I'm happy to report that that data need has been met. There's still a lot of data quality, interoperability questions, getting that local level data that Pablo mentioned, but there is some reporting already on those programs. In Canada, we also, our organization published a short consultation brief on the results of this meetup that I'll share with you in the chat after I speak. But one of the biggest impacts, like I mentioned, our role was really to convene people in this dialogue. And we at the end of our event, our keynote speaker, the Chief Statistician of Canada, said, each number is, this is a quote, each number is connected to a human story, a neighbor, a family business. This is a dialogue with Canadians. This conversation has to continue. And I think we were really proud to have brought him to see all of these unique perspectives, to really understand what the data need is in Canada, and to bring into his mind the need to consult and work with the public in these meetup settings. So I'm really happy to see this is happening in Slovenia, and to share kind of that peer knowledge amongst our partners. And yeah, so thank you so much again for inviting me and being able to share kind of our story.
Thank you very much. I had to unmute myself. So let's continue. Thank you very much for the praxis of Canada. And Nuria Espuni Salvador. I hope I pronounced correctly. I don't know. I'm sorry if I didn't. General Director for Transparency and Open Data will speak about experiences of Catalonia. Welcome, and the floor is yours.
Hello, everybody. Good afternoon from Catalonia. First, I would like to thank the organization for inviting us to join this meetup. We will be very pleased if we can help in a way by sharing our previous experience with you. Well, I will try to share my presentation. Can you see it?
Yes, we can see it
correctly.
Yes, it's okay.
Perfect. So, yes. Well, I realized that my presentation takes longer than 5 minutes. So the first one is just to put on context the situation. So I will go through slide number 5 directly and explain our, oops, I don't know, something is wrong. Oops. Okay, so our meetup, we decided to work in 3 key areas: economic impact, social and vulnerable groups, and gender impact. Each of these key areas had a reference person who had the responsibility to facilitate the debate and help to deal with the different dimension of the analysis. The meeting gathered more than 40 people from various fields working with open data. And the purpose of this coming together of professional and expert was to approach these 3 main goals, to discuss how we can improve the collection and the processing of data, to build useful resources, and to discuss how to get not just data, but quality data, as our colleague from Mexico has just remarked. I think so that it's very, very important. So, excuse me, because I have some problems. This one, okay. And what we learned is the main aspects we would like to highlight from the meetup are first, more data doesn't mean better data. Again, the group recognized that it was important to remember that simply having a large amount of data does not equate to better information. They recognize that the data needs to be organized and converted into useful information. It means not just give the data, but trying to convey the information that is beyond the data. And also that we need is to standardize some parameters such indicators, data sets, metadata. In second place, it was agreed that privacy matters, and the participants in the working group understand that there are mechanisms to anonymize the data. However, it was pointed out that if, oh, sorry, my presentation. So it is important to notice that the data was collected by a private company, that it could be difficult to trace or to track what could be done with this data. So take care with the gap in the control of these data outcomes. And the third point was that when discussing social impacts of COVID data on vulnerable groups, the working group see that because there was no data about certain groups of people, then the group not seem to exist. So the challenge was in the collection of such data and who were responsible for this collection. And the working group also recognized that Catalonia lacks data from gender perspective, both in general and with specific regard to COVID. And for this reason, we decided that one of the groups had to work specifically on gender issues, showing our commitment to remedy this gap. So, well, if you want or you need more detailed information, you can find it in these reports, including the specific conclusion for each of the areas with the detail of the data required for each group. I'm sure that the organization can send you this presentation, and you can find the link of the reports inside. And just to end my speech, let me tell you the final conclusions we reached. First, we got an overview of needs and demands in terms of data of the three key areas that we worked on. Another conclusion was that everybody who participated in the meetup was aware of the great benefits of it. We need to share the problems and try to fix them in a collaborative way. I firmly believe that collective intelligence is always more powerful than the individual. And finally, I would like to highlight the value of gathering together experts from different areas, so to work with a multidisciplinary group. And well, there is another conclusion that it isn't written in the slide related to the meetup duration, around 1.5 hours. It was enough just to get a general idea, but participants put the point on the table that we need a second meetup with a longer duration of 4-6 hours in order to go in depth into this analysis. Well, that's all. So thanks again for your kind invitation to be here today. And if you have any question or need some other information, please feel free to contact us. We will be very pleased to answer it. Thanks you again.
Thank you. Thank you very much for sharing your experiences of Catalonia. And now, before we go to Slovenian practice, I would like to invite you to our chat. Maybe not to send something, but at least to be careful on our chat, because some interesting details you can find out there about breaking rooms and so on. So kindly invited. And now let's continue. Slovenian praxis will be introduced firstly by Mrs. Maja Založnik, Coordination, Data Model and Validation at the project COVID-19 Sledilnik. So Maja, kindly invited.
Hi, can you guys hear me okay?
Yes, we can hear you okay.
Okay, I'm not able, oh my God, I'm not able to share my screen. Sorry, just a second.
May we help you somehow, Maja?
Yeah, I'm not sure, because we did try this before, but damn it.
There should be a button in the...
No, I see, but it's saying my browser is preventing it, even though... let me try again. Okay, sorry. This should work now, hopefully. Can you guys see my screen? Okay, good.
Okay.
Technical crisis averted. Okay, so yeah, my name is Maya. I'm a demographer, and I'm also one of the data managers for the Slovenian COVID data tracker, Sledilnik. We are a crowdsourced, volunteer-based project, and we're dedicated to compiling and publishing and visualizing data related to the epidemic in Slovenia. And our aim is to give the public and, of course, decision makers a comprehensive overview of the epidemic in the country and allow them a better assessment of the situation. And we're really good at what we do. Almost 1 million unique visitors to our site per month can attest to that. And that's out of a population of 2 million. What you see here is just a quick scroll through our website. But the important part is hidden behind the charts and the maps that you see here. It's the database that's behind all of them. It's the data that we receive on a daily basis that we check and clean and structure and make it publicly available on our website and through our API. So I wanted to tell you a short data story today. And first we need the background. So the context, the stripes represent the population structure of Slovenians. So pink is over 65s and yellow are under 24s, and the green part in the middle, that's approximately our working age population. So the first chapter in our story is COVID testing. So we can see here that younger cohorts are considerably underrepresented, and in fact, so are most of the oldest, except for the over 85s. While the active population, the green bars, they're getting tested a bit more than one might expect. The second chapter in this story are, of course, the test results. This data allows us to look at age-specific positivity rates. We can also see that it's the working age population where most of the infections are being confirmed. And this also gives us an idea of what effect vaccinating the over 65s might have on community transmission. The next chapter, of course, are hospitalizations. Here we can see the pink, the over 65s represent the great majority of people in hospitals, which also means we can expect vaccination of those age groups to bring significant relief to the hospitals. And then, of course, we have intensive care units. Again, here we see over 65s represent the great majority. Also see the structure change a little bit. There's only 4 age groups now. One of the reasons is that over 85s are generally seen as too frail to survive intensive care, and so they're usually not admitted. And then finally, we have the age structure of deaths with COVID. And as you'd expect, this population is the oldest of them all. Only about 5% are under the age of 65. And again, we can infer that vaccinating these age groups will have a massive effect on the expected death toll. So I tried to make this story super short, just to show you that a really quick analysis with very simple and accessible data using only age groups can give us a lot of insight into the epidemiological situation. We can learn about how testing is accessible to different age groups at different rates, and that affects how we can model confirmed cases and hospitalizations and deaths. And it also lets us think about how the vaccination rollout will affect these outcomes. But there's one problem with the story, and that's that I lied to you, because you see, we don't actually have this data. This is the data that we do have. That's publicly available. So only positive tests and age structure for the deaths. I didn't make the rest of it up, of course. I know I used personal connections and asked really, really nicely. And so I got a one-off, we got a one-off data dump from one of our national testing labs in one of our hospitals. So the data is out there. It's being, and what I showed you is real, but it isn't representative and it's not a regular data flow. So that makes it quite useless to us, except to prove my point. So what is my point? I know there's no shortage of tragic stories in this pandemic, but here's another one for you. I'll call it the tragedy of underutilized data, or wasted data, if you will. Because I'm not describing some sort of fantasy of like, oh, wouldn't it be lovely if this data existed? I'm talking about data that we know is out there. And there are people, a lot of them frontline workers, who are entering this data into their computers on a daily basis. but the data isn't really being used, or rather it's being massively underused. So this is a story about systemic waste of public data. But I also think it's a story of low-hanging fruit. I think this data is often collected almost habitually without a strategy about what to do with it. So here is a strategy for you. Open it up and don't let it go to waste. We're talking about anonymized data with no risk of disclosure. We're talking about data that requires minimal processing. And this is data that if it were made public, not just to us, to everyone, it can offer insights that go far beyond what their individual owners would be able to do with it, even if they had the will and the capacity. And I can only sympathize with the lack of human resources that the relevant agencies and institutions are faced with, especially in this time. But we're all aware of the vital role that data plays in a pandemic, and the cost-benefit calculation here, I think it's simply a no-brainer. That's all. Thank you.
Thank you very much. This is Maja Založnik from Project COVID-19 Sledilnik Tracker. Thank you. And now Mr. Marko Grubelnik, kindly invited to present us your presentation, your words. Coronavirus Watch, expert researcher in the field of artificial intelligence in Slovenia. Please share with us your view, your experience. The floor is yours.
Yeah, thanks. So a year ago when Corona started, right? So we did a couple of things, and not to go too much into any kind of details, I will show you just a little bit of reflection from the side of media, coronavirus and media. Let me share the screen, right? So what you see here now on the picture is pretty much live feed of coronavirus or COVID news as it happens right now or in the last few hours, right? So so practically whole media space is filled with news related to coronavirus in one or the other way. But okay, let's turn the time back. So year ago, roughly a year ago, I was in Brussels, and I was giving the presentation to state secretaries. It was kind of interesting presentation, well, nice audience and so on. And I was thinking what to show back then, right? And I said, okay, let's analyze something fresh, something which seems like it's a relevant topic at that particular moment. And I said, okay, let's do coronavirus, right? And let me skip this first slide. So this is the slide from January 28th, year ago, right? So it was kind of sort of interesting topic back then, right? So you see, from December 28th till January 28th, our system, this is a system called Event Registry, which collects pretty much news from the whole world in real time. We collected 75,000 articles. Can you imagine? 75,000 articles in 50, pretty much in all world languages, right? And the news back then looked like this, you know. First confirmed US case of new coronavirus reported in Washington state. Well, terrible, right? Or China confirms 139 cases of new virus in 2 days. Well, huge number, right? 139, right? And stories about bats and so on, right? Okay, then we did a little bit of analysis on this. So this was one of the slides which I was showing, like this big new topic, right? With 139 cases in 2 days in China, right? So this was quick analysis. So what kind of topics, who was involved, what kind of people, sentiment, places which were mentioned, Wuhan back then mostly, and time-wise, okay, the news were mostly from mid-January till the end. Even from the first half of January was not even well covered in media, and so on. And which languages were covered, or nations were covering this. Kind of interesting, right? So these are locations of these coronavirus related events, right? So worldwide, mostly of course China, Europe, a little bit of in US. US you see mostly empty, right? A little bit of Europe, and mostly this reporting went on Wuhan, basically, right? Yeah, and so this was the big news was basically this Wuhan and animal market. Okay, nice. Okay, this is a little bit of history, but let's see what now 1 year after, right? Let's first check another virus, which happened something like 6 years ago, Ebola virus, right? Remember Ebola virus, right? So this is how the media reporting went up. So this was the outbreak back then, mostly in Africa, right? So this is the spike, and then somehow went down, and then Ebola never disappeared really from news. There were always small outbreaks and so on, but kind of nice, huge spike. Okay, great. Let's see now how the spike of coronavirus looks like. Now you see nothing, right? And this is beginning of 2020, huge spike. Now, if coronavirus, if Ebola was covered altogether with maybe a few 100,000 articles, now within this year we collected just on the coronavirus roughly 40 million, 40, right? 40 million articles in all the languages, right? And now, since I showed Ebola and Corona, right, let's compare them just so that you see how these things go along, right? You see this small spike here? So this was Ebola, right? So the rest is coronavirus. So okay, this is just one insight in possible global view to coronavirus. So this coronavirus watch portal helps doing this. It has many more functions, but I won't go too much into details, right? So now using this media data, so obviously we didn't stop. So later, I think Mario Fafangel will talk as well. So we have now a good plan somehow to use this media data to analyze the let's say soft elements, beliefs across the world in vaccination and other aspects of not just Corona, also other things. But let's say this is one way how to approach the global overview of Corona and other diseases, right? So much from my side, not to be too long. Thanks.
Thank you very much. Thank you very much, Marko Grobelnik. And now thank you all, dear speakers, for your introductions and views.